Life Unrehearsed, brought to you by Lianas Senior Transition Support, specialists in downsizing and seniors residences.
And good afternoon. Welcome to Life Unrehearsed. My name is Matt Delvecchio, specializing in life transitions, downsizing in the senior living industry.
And I'm Corrie Sirota, clinical social worker and psychotherapist specializing in grief and loss.
Coming right up on the first half of today's show, the pandemic has been difficult for many people, but it has been particularly challenging for families that may have a loved one living with dementia. Is there a way that we can help prevent dementia? Well, we're going to be tackling this topic on today's show.
Great topic, so interesting. But before we even get there, Matt, I saw a photo, and our listeners need to hear about this. Matt, was that you in stilettos?
Yeah, the short answer is yes. The red stilettos, 4-inch stilettos, in fact, all for a good cause. The wonderful people at Royal LePage Village tomorrow are holding their annual Walking a Mile in Her Shoes, big fundraiser for Auberge Transition. Auberge Transition is a wonderful organization supporting women who are experiencing spousal abuse. Now, I got to tell you, Corrie, it is quite the scene. We're walking down in NDG, down Monkland, 30, 40 guys walking in these red stiletto heels. A good mile, so we're talking a kilometer and a half. And needless to say, we do feel the pain and the feet and the calves and everything else. We feel it, that's for sure. But it's quite the scene to see that.
I have no doubt, and we will absolutely need photos of this. But let me tell you, welcome to our world.
No kidding.
It really, I mean, the cause is, you couldn't come up with a better cause, no question about it. But very, very interesting, very, very impactful to say, for women who are struggling with spousal or partner abuse to be able to raise some funds.
Such a great cause. So tomorrow, if you see a bunch of guys walking in red stilettos in the morning in NDG.
That's so great.
What do we have coming up on the second half, Corrie?
Well, more and more people are hopping on planes as our confidence level is building up with the vaccines, etc. Yet, flying can still be very challenging as we are coping with this fourth wave. So we're going to be talking to an airline purser who's going to provide us with some very integral and helpful travel tips. That's coming up after the 3:30 news.
Yeah, going to be very interesting. More and more people traveling, and a little anxious travelers, I'm sure. All right. Corrie, did you know September is actually World Alzheimer's Month in Canada? Here's some just amazing statistics. In Canada, more than 500,000 people live with dementia, and it's predicted that this number will rise to nearly 1 million people by 2033. It's just over 10 years from now. And the cost of dementia, people don't realize how costly it is. It's estimated to have been $12 billion, and I'm talking just in Canada, in 2020, and it's projected to exceed $16 billion in 10 years by 2031. And a lot of people don't realize there's a ton of out-of-pocket costs paid by Canadian caregivers as well. So to discuss this with us is Camille Isaacs. She's the vice president of a wonderful organization called Hope for Dementia, based right here in Montreal. Camille, welcome to Life Unrehearsed.
Thank you.
Well, thanks for coming on, Camille. Such an important topic affecting many, many families. And, as mentioned, we're seeing a significant rise in people living with dementia. The pandemic has not been easy on individuals and especially families who have a loved one with dementia. And your organization is a big proponent of taking proactive initiatives to prevent dementia. And good for your organization to do this because, in fact, you're publishing a white paper in a few days, and I've had lucky enough to have a preview of this white paper in which Hope for Dementia states that the current trends in growth of the number of people affected by dementia presents an unsustainable trajectory. And I like that term. It cannot continue the way it is. But this trajectory has to be bent downward if appropriate prevention strategies are widely implemented, and you are a big proponent in prevention strategies. And in fact, you break this down into 3 strategies in this white paper that I think our listeners would be, we want them to hear. And let's start with the primary prevention strategy in this white paper.
Okay, first of all, Matt, thanks for inviting me to speak about this very important issue. And yes, so our white paper will lay out in more details what prevention strategies are. We actually have prevention strategies that address prevention, deceleration, and reversal of dementia symptoms. We believe that these strategies can be integrated throughout the 3 levels of our public health system in the primary, secondary, and tertiary health care. But to be more specific, primary prevention strategies aim to improve the overall health of the population by reducing the number of preventable dementia diagnoses through education, regular proactive screening, and then risk mitigation and management in the general population. So what this means... Yeah, go ahead.
I wanted to ask you if you could be more detailed about what maybe some examples of you mentioned one of the many things were proactive screening. What does that even mean?
Okay, so the first thing is that we need to integrate cognitive screening questionnaires in our annual medical exams and in public education programs. When we go for routine medical checkup, we get all our blood work done, the doctor checks off our blood sugar levels, our blood pressure and all, but nobody's talking about how is your brain health? Have you had any issues with cognition? And I think that this is essential. For us to move forward, we need to integrate cognitive screening in our in routine medical exams, and people need to ask for this. And we are recommending at Hope for Dementia that mandatory public health reminders for dementia screening should be sent to persons over 50 years of age every 2 years. Right here in Quebec, I'll use an example. Every 2 years, I'm over 50, and every 2 years I get a reminder from the government to go and get a mammogram because I'm at risk for breast cancer. Why can't we do the same thing for dementia?
Yeah, I think that's just a brilliant example. It's so true, Camille. Listening to Life on Rehearse with Matt and Corrie, and that's the voice of Camille Isaacs. She's the Vice President of Hope for Dementia, which is based right here in Montreal, bringing up a very important point. They've got a white paper that we're discussing, and we talked about this primary prevention strategy, and I love that example. It's just a shift in attitude. You're doing your mammograms. Us guys, we go for I'm 55, so PSA in the blood tests every year. And why aren't we doing some cognitive testing to find things out a little bit earlier? So, Camille, you mentioned there are 3 strategies. The second one, prevention strategy. Can you elaborate a little bit more on the deceleration?
Okay, so the secondary prevention strategies would target at-risk groups. The primary prevention looks at the general population, but then now we get more specific targeting at-risk groups. And these strategies would involve symptom deceleration measures and risk mitigation measures for those persons. So examples of symptom deceleration strategies include like nutrition modification, assessment and stimulation activities to delay cognitive decline. And these are also aimed at preserving the health of persons who have been diagnosed with mild cognitive impairment. And to do this, it's important to ensure that the work of the healthcare providers and social services are coordinated effectively. Patients or people who are at risk, people who have had a brain injury or who are diabetic or who have Parkinson's, they are meandering through the healthcare system and not really understanding how the services can be coordinated to help them more effectively manage any risks that they're facing or even the early symptoms that they may be experiencing. So this is where we feel that the secondary prevention strategy means more targeting of people who are at risk and more effective coordination of the services that are being delivered to these people. Yeah.
Camille, can you mentioned cognitive stimulation. Can you give us one or two? We have to go out to traffic shortly, but one or two activities or examples of how we keep our brain sharp?
Well, keeping our brain sharp, first of all, is I think, first of all, we have to start by protecting our brains. We keep those of us who are involved in any sporting activities to wear protective headgear. We also need to be doing things like learning a new hobby or continuous learning, removing social isolation, being involved with other groups of people, because social isolation, which is a part of the pandemic, also puts people at a higher risk of cognitive decline. So to keep our brain sharp, we need to be more physically active. Those people who are smoking need to quit smoking. We need to reduce our alcohol consumption, avoid exposure to air pollution. I mentioned wear protective headgear. There's also the importance of managing your weight, blood pressure, blood sugar levels, and hearing. These are some of the factors that researchers are finding contribute to dementia and cognitive decline. And these are risks that can be managed.
Yeah, and these are manageable risks, and a lot of it is very basic, but now it has been scientifically proven. Like you're saying, there's more and more reports coming out to help prevent dementia. Now, Camille, we have to head out to traffic. We know there's no cure for dementia, but you're seeing a lot of research, and we want to hear from you about some of the latest research. Is there hope that a cure may be found one day?
Life Unrehearsed, brought to you by Flora-Lee Senior Residences. Always there for you. Safe, reassuring, and comforting. We call it home.
Welcome back to Life Unrehearsed. I'm Corrie Sirota, along with my co-host Matt Del Vecchio, and we are talking with Camille Isaacs, Vice President of a wonderful organization called Hope for Dementia. It's based right here in Montreal. And I'm really curious to hear the answer to this. We were chatting before the traffic. We talked about, I think we know that unfortunately right now there is no cure for dementia. But based on what you're seeing with a lot of the latest research, you're right au courant with that. Is there hope that a cure might be found?
Well, Corrie, we have to try new solutions or test new hypotheses. The commonly held hypothesis is that, well, the amyloid proteins that are built up in the brain, these need to be cleared, in order to cure dementia or Alzheimer's. Scientists have been working on that. In fact, a drug has recently been released that is aiming to clear amyloid proteins in the brain, which, is a common pathology for dementia or Alzheimer's. There are other researchers who are testing multiple causes. In the earlier segment of the conversation, I had mentioned that there are some risks that can be modified, like nutrition and high blood pressure and diabetes. There, as recently as May 2021 this year, there was a proof of concept trial in the United States where persons diagnosed with mild cognitive impairment or early dementia were treated with what we call precision medicine, targeting specific biomarkers or specific symptoms or causations of dementia, and the results were promising. This we will show in our white paper that will be published next week. Mm-hmm. But the point is that what we're seeing now and what we're hearing the researchers tell us is that it's several factors that combine that lead to dementia. And if we can isolate or identify those causes and treat them specifically at the early stages, there is the likelihood, and there has been some proof that some of these symptoms can be reversed or decelerated.
And that's a big part, Camille, of what Hope for Dementia is in prevention strategies. How can that trajectory, which is increasing hockey stick style, how can we turn that the other way around? I'm getting a lot of calls in my world supporting seniors in transition. Let's face it, the pandemic has been hard on many, many families. A lot of adult children are the sandwich generation, they're starting to go back to work in the office, and they just cannot do it anymore. They're tired, exhausted. And I'm glad I'm able to help. However, I get this question all the time, Camille. I'm sure you do as well. What resources are out there to support families who have a loved one living with dementia?
Yes, we do have quite a few resources. Of course, it's not enough. But I'll just mention that there are day centers and stimulation programs offered by various organizations in Montreal and throughout the province and in fact nationwide. Here in Quebec, we have around 20 Alzheimer's societies in the regions of Quebec, including the Alzheimer's Society of Montreal. There are other organizations such as Alzheimer Group, Inc., Swan Gabriel, Nova West Island, and many others that offer services to persons with the disease and their caregivers. But these are people who are in the moderate to more advanced stages. What Hope for Dementia is trying to do, and what we are in fact doing, we are providing services that are more preventive in nature to persons who are at risk or are in the very early stages of dementia. Our services include the distribution of baskets of food that promote and protect brain health to vulnerable seniors. There's also the Just Connect program, which inspires people to call or safely check up on seniors using electronic tablets and iPads. And just to point out that electronic tablets not only function as a method of communication to seniors, but there's also a new medium they can use to challenge their brains. So they can use the tablets also to have brain games and other apps that offer a new way to maintain their brain health and learn new skills. Mm-hmm. And the other thing I want to point out, which is really important, considering that we have a growth trajectory, the current generation of millennials and younger will become caregivers of their seniors. What we also are encouraging, and we do have a program at Hope for Dementia, is an intergenerational learning program that connects youth with the elderly population to bridge the gap between the generations. Our youth volunteers engage in technology-focused seminars that aim to educate senior citizens on the digital age, and in turn, the seniors are asked to teach our youth volunteers something meaningful to them. So,
some terrific programs there that you have, Camille. It's really impressive. That is Camille Isaacs, the voice of Camille Isaacs, the vice president of a wonderful organization called Hope for Dementia. And that organization is based right here. We're rounding up. I could talk to you for a lot longer, but I want to ask, it's going to be tough. What quick one piece of advice would you give to families who have a loved one with dementia? What would it be?
Get professional help and support for your loved one. Love and care go a long way, but without professional help and support, caregivers of persons living with dementia are twice as likely to burn out. So you need professional help to support you in caregiving.
Yeah, and you're so right. And as the disease progresses, the research comes, it is more profound, and there are becoming more and more resources. And reach out to your professionals, reach out to your community. I'm so glad, Camille, you mentioned Nova West Island. I'm on the board of Nova West Island. You talked about these iPads. It's becoming more and more popular, and it is. Don't be afraid to ask. We just got a text saying some people don't have family or friends left. What are they supposed to do about social isolation? And there are many organizations out there. Reach out to 811. If you really don't know where to start with 811, and they're going to be able to give you your local organizations. Camille, we're already running out of time. If people are interested to find out more about Hope for Dementia, where can they go?
Visit our website, hopefordementia.org. hopefordementia.org. And if you have questions or you want to, find out more or have a conversation with me or my colleagues, send us an email, info@hopefordementia.org. Okay.
All right, Camille. Thank you so much for joining us on Life on Rehearsed.
And thank you so much for having me. And I do hope that people are aware that there is hope for dementia.
All right, great. Thank you. It's Camille Isaacs, Vice President of Hope for Dementia, based right here in Montreal. Corrie, what do you have coming up on the second half?
More and more people are hopping on planes, yet flying can be really challenging as we cope with the fourth wave. So we're going to talk to an airline purser who's going to provide us with some very helpful travel tips. That's coming up after the 3:30 news.